I really understand how the system is failing from the inside, failing the patients and failing the providers, failing physicians, who are obviously really critical. If we're going to make this system work, it's got to work above all for patients and especially for physicians. For patients, there are just staggering issues and costs, and the costs are skyrocketing, really haven't been helped at all by the recent healthcare reform. They're mushrooming as flagrantly as ever. And this is, a serious problem for the state. Healthcare has gone from 35% of our budget 10 years ago to now 50%. So it's 1 out of every 2 tax dollars is being spent on healthcare. It's just staggering, but we don't have a whole lot to show for it. It's true, the net of care has been expanded, and that's a good thing, but for so many people, they can't really afford to get the care that they need, and the cost of premiums and the cost of copays and the incredible gaps in coverage are really serious for patients. So for seniors covered by Medicare, for example, they are paying in Massachusetts 30% of their income in out-of-pocket medical expenses. 30%. It's really staggering. That's the average yearly cost to seniors. So it's not working for our state government because it's eating up the tax dollars we need to be spending on schools and police and fire and all that. So our state government is in serious jeopardy trying to pay its health care bill. Our cities and towns, likewise, it's gobbling up their budget. And for small businesses, this is staggering, and the reason that most small businesses give for why they can't expand and why they're in such dire straits right now. And then, of course, for workers. And we're seeing the approach from our current office holders. They're all talking, in fact, all the other 3 candidates are talking about shifting costs. That's how they're going to deal with the skyrocketing healthcare costs, is to simply cut care and shift the cost onto workers and families and small businesses. That's not a solution. So, that's sort of the patient and consumer problem. And from the point of view, obviously, of physicians and our hospitals, it's not working, especially for our safety net hospitals. We just saw the other day where the Boston Medical Center is laying off large numbers of staff, including 40 nurses, and they can't afford to do that. I mean, patients can't afford for that to happen. And our community hospitals are obviously in really dire straits too. So it's not working for so many of our hospitals. And above all, the bottom line here is that it's not working for physicians. So we're looking at, the incredible workforce problems that we're struggling with in Massachusetts. We have a crisis in primary care physicians, in family medicine, in internal medicine, in OBGYN. We don't have the providers that we urgently need. And with healthcare expansion, it's been a disaster, so that we're looking at just incredible wait times. And what is it, like almost 50%, I think, of internists and family physicians have essentially closed their practices. So, this is serious stuff. Many physicians are leaving, and our residents who are graduating from our many wonderful programs here are not staying. So the financial environment for physicians is very difficult. Steep costs of living here, high malpractice costs, and relatively low reimbursements. And the bottom line is people are drowning in paperwork. I'm, as a physician myself, in a family of physicians across the specialties, I am well aware of how people, physicians are just drowning in paperwork and in micromanagement by, health insurance CEOs. And that's not who should be running our practices, who should be usurping our time, and who should be dictating clinical decisions. We need to get physicians out from under the health insurance bureaucracy. Fortunately, there is a unifying and simple prescription which has the incredible virtue of costing us nothing. It basically pays for itself at the same time that it straightens out just a whole slew of problems that we alluded to before. So what I'm talking about basically is a tried and true solution that's been tested in many healthcare systems all around the world, and in fact it has proven to be the only way in which we can get to affordable care that actually covers everyone. And that's by simplifying the massive and expensive health insurance bureaucracy, which eats up, a huge amount of the healthcare dollar. Nationally, it's about 35% plus. In Massachusetts, it's less, but it's still significant. So we don't change practice at all. What we do, in fact, is liberate physicians and providers to actually practice, which is what we want to do. We trained long and hard. We are devoted, and physicians are incredibly committed to their profession, and and the most exemplary workforce, I think, anywhere here in Massachusetts. But we have been so badly buried in paperwork, and it only got worse with healthcare reform. So we need to get physicians out from under that mountain of paperwork so they can actually do their practice. And at the same time, we save about 15%, it's estimated, right out of the gate in the cost of healthcare by streamlining the insurance and creating one quasi-public insurance provider. So instead of having to track who's the insurer, what are their rules, which pharmaceuticals do they cover, and what doses, just that whole morass of paperwork and micromanagement and rules and regulation, physicians can just practice the way they want to practice, and they don't have to spend their time on record keeping. So, and the wonderful example is this contrast that we hear all the time between Massachusetts General Hospital and Toronto General Hospital. Same size, basically, but in one case, in Mass General, it's hundreds of people. I've heard as much as 600 staff size to be doing their administrative work and their insurance tracking, whereas under a single payer system in Canada, it takes about 6 people to do the insurance work for a similar sized hospital. So this is the virtue, and it means retraining our insurance workforce, and there's plenty of other things for them to do, but let's have them doing productive work rather than paper pushing, which takes away from the productive work that our healthcare system needs to do. So we save a lot of money across the board. It allows us to get down to business with the pharmaceutical companies and the medical device manufacturers, so that we can actually bargain and come up with good prices that can save us a lot of money and bring down the cost and ensure that we're delivering products that people can pay for. So we have another cost savings right there. And for physicians, this enables us to provide the salary support that our physicians need. Because we're saving a lot of money in these 2 other areas, we can now begin to provide physician support. And furthermore, because physicians get freed up from the insurance bureaucracy, they can be much more productive with their time and can actually be seeing patients and generating the income that physicians need in order to have productive practices. So many physicians are really at the margins in Massachusetts now because of the expense of the environment. And one last final advantage is that the costs of malpractice generally go down in a single payer system. And that's because one of the major components of malpractice settlements is the cost of care. So the cost of care basically is removed from malpractice settlements, and that helps to, even before you get to tort reform, which is a whole other question, simply by moving to a single payer system, we kind of take the wind out of the sails of the very expensive malpractice system. So this reduces that pressure on physician practices as well. So this is a win-win for patients, for physicians, and for the health of our Commonwealth, and especially from the point of view of policymakers, this is a really great thing for our budget because we get better health care, and it relieves that incredible burden that we're feeling in state government, local government, small businesses, and families across the board.